Are you able to hear me?
Miss, I think most of us are here.
Yeah, right. Okay. So today we will start with fetal circulation. So before going into fetal circulation, I just want to um, review our normal circulation. So in case like if you take our normal human being blood circulation, so this is your right side of heart and this is your left side of heart. Okay, so this is right side and this is left side. So right side of the heart will be receiving all the deoxygenated blood through the inferior vena cava and the superior vena cava. So this is your inferior vena cava and this is your superior vena cava. Okay. So through this superior and inferior vena cava, the right atrium will be getting all the deoxygenated blood. Then from the right atrium, it will go to the left atrium. Then from the left atrium, it will be going to your lungs through pulmonary artery. Then in the lungs, it will get oxygenated and through your pulmonary vein, it will be received in your left atrium. So left heart will be purely oxygenated. So it will be received in the left atrium. Then from the left atrium, it will go to the left ventricle. From the left ventricle through aorta, it will be circulated through the body. Okay, so this is your aorta, which will be having a ascending aorta and descending aorta. So ascending aorta will supply the head and the upper part of the body. Descending aorta will be supplying the lower trunk and the lower leg, lower limb. So this is the normal circulation. Okay, so you will be having right atrium which will be receiving all impure blood. Then it will go to the right ventricle. Then from right ventricle through pulmonary artery it will be going to the lung. Then where it will get oxygenated. Then through pulmonary vein it will be coming back to left atrium. Then from left atrium it will go to the left ventricle. From left ventricle it will go to the aorta. Okay, so this is the normal human circulation we will be having. So now we will see how we will be able to, 1 minute. Okay, so this is the normal circulation, but in a fetus, or you can say when the baby is inside the uterus, it doesn't need this kind of blood circulation, because the blood which is received by the baby itself will be oxygenated blood. So it will be receiving only oxygenated blood from the mother. So it doesn't need to go through this kind of circulation. It has a extra adaptation. Okay, so that only we are going to see. So if you see here, this is your placenta. Okay, so through the placenta, you will be having umbilical vein and the umbilical artery. So umbilical vein will be having pure oxygenated blood. Umbilical artery will be carrying deoxygenated blood. Okay, so from the placenta, you will have the umbilical artery, artery and vein, but umbilical vein will be carrying pure oxygenated blood. So this red color one is pure oxygenated blood. Okay, so this umbilical vein will be coming out of the placenta and it will be passing through it will be going into the baby as umbilical vein. Then from umbilical vein initially, before joining into the inferior vena cava, if you see this blue one is your inferior vena cava. So this umbilical vein will be joining with the inferior vena cava. But before joining into the inferior vena cava, it will be giving a branch called portal sinus. Okay, so this is called portal sinus. So one branch that will be giving oxygen supply to the liver of the baby. So in a baby, liver is the one part which will be getting 100% oxygenated blood. Okay. Then this umbilical vein will be joining with the inferior vena cava of the fetus. So in this inferior vena cava of the fetus, some amount of deoxygenated blood will be there, which will be from the lower limb of the baby. Okay, then this inferior vena cava will be going into right side of the atrium. Okay, so this inferior vena cava will be joining with the to the right side of the atrium. So from the right side of the atrium, there will be a opening called foramen ovale. That is, right and left side of the atrium normally doesn't have an opening, but in the fetus there will be an opening called foramen ovale. So when the heart is getting compressed, some amount of the blood will be going into the left atrium directly without going into the right ventricle. So without passing to the right ventricle, most of the blood will be going into the left left atrium. So from left atrium, it will be it will be going to the left ventricle. From left ventricle, it will be going to the lung, where there won't be any oxygen. Okay, so that is just a blood supply to the lung. Then directly from the left ventricle, lot of the blood will be going to the aorta. Is that clear? So there are two adaptation here we are seeing. One is the portal sulcus sinus, which is a direct branch from the ventricle umbilical vein. It will be going to the liver of the baby. Then second is this foramen ovale, which is the opening between right and the left atrium. So this little bit deoxygenated blood will be going directly to the left ventricle. From the left ventricle, some amount will be going to, it will be going to the from the left atrium, some amount will be going to the left ventricle. From the left ventricle, it will be going to the aorta. Okay, so here if you see, the pulmonary artery and the aorta will be having another branch attached. Okay, so the pulmonary artery and the aorta will be having another branch attached. So here you can see the branch attached. It is called ductus arteriosus. Okay, so the blood which is going to the pulmonary artery also will be attaching to the aorta instead of going into the lung directly. So this is the third adaptation. Then from the aorta, some half of them it will go to the superior vena cava. Superior ascending aorta. Half of them will go to the descending aorta. So here in the ascending aorta, it will be supplying the upper limb and the head. The descending aorta will be supplying to the lower limb. Then from the lower limb, the deoxygenated blood will be collected through the umbilical arteries, and the umbilical artery will be taking the deoxygenated blood outside the fetal body through your umbilical artery and placenta. Okay, so some will be like some in the inferior vena cava will be again going into the circulation. So if you see in a fetal body, only 100% of oxygen means only the liver will be getting 100% of oxygen. Then the head and the upper limb will be getting around 95% of oxygenated blood. The lower limb will be getting a little more lesser percentage of oxygen. Is that clear? So this is what happens in the fetal circulation. So after the birth, this fetal circulation will be totally stopped. So after the birth, if you see, this fetal circulation will be completely stopped. That means they will be cutting the placenta. So there won't be any blood to the uterus, uterine artery or uterine vein. So when the blood flow to the placenta stops, the baby will not have enough of oxygen. So when the baby lacks in oxygen, it starts to crying. So when it is crying, when it is opening the mouth broader, automatically the lungs will be getting more of oxygen. Is that clear? So why the baby cries immediately after the delivery means When you cut off the placenta, there won't be oxygen supply to the baby. So the baby needs oxygen, so it starts to open up the mouth. So when it starts to open up the mouth, the lungs will start to get more amount of oxygen. So when the lung is getting more amount of oxygen, there will be the blood flow to the lung will increase. So the pulmonary artery, which is giving the blood supply to the lung, will increase. So there will be lot of oxygenated blood collected in the lung, and that particular oxygenated blood will be taken through the pulmonary vein to the left atrium. So the left atrium will have pure oxygenated blood, the right atrium will have little bit lesser. Because of this percentage difference or the pressure difference, the foramen ovae will get closed automatically, or it will get closed. Okay, so once the foramen ovae is getting closed, the blood will flow to the left ventricle, then through the left ventricle to the aorta it will be passing through. So there you have something called ductus arteriosus. So now if you see, the aorta will be having more percentage of oxygen compared to ductus arteriosus. So there also, because of the pressure difference, the opening will get closed. So this pure oxygenated blood will be passing through the ascending aorta, then it will also pass through the descending aorta. Is that clear? So this is how the two openings get closed. Then automatically your umbilical vein or your umbilical artery will be getting degenerated because there is no blood flow to that particular veins. Is that clear? So it may be a little bit confusing. Let me show you one video so that you, it will be more, uh, for your more understanding, I'll just show you one more video. Okay.
To really understand fetal circulation, first you need to know some basics about postnatal circulation. So here we have a basic diagram representing postnatal circulation. So if you imagine the way that blood flows through the body, if you've got a diagram here of the lungs and here of the body, let's say blood starts in the right hand side of the heart, in the right atrium, flows to the right ventricle, then this is pumped out into the pulmonary arteries, which takes blood to the lungs. You get rid of CO2 there and you pick up oxygen there. It then comes out of the lungs through the pulmonary vein into the left atrium, left ventricle, and then out into the aorta. And from there, all that oxygenated blood is taken to the body where it's used, and the blood then picks up the byproducts of respiration, such as CO2. These are then taken back via the inferior and superior vena cava back into the right hand side of the heart. So essentially, the objective of postnatal circulation is to take blood from the right side of the heart to the lungs, then to the left heart, then to the body, and then to return back to the right hand side of the heart. So next we have a diagram that represents the fetal circulation. You can see it's a little bit more complicated, and that's because the objective of the fetal circulation is to take blood to the placenta instead of the lungs to get rid of those waste products and to pick up oxygen and nutrients. So let's label this diagram. Okay, so you can see some key structures here, and some things that I particularly want you to pay attention to are the ductus arteriosus, the ductus venosus, and the foramen ovale. Now these represent the three fetal shunts, and they're essential to making sure that the fetal circulation works properly. Let's go through how the blood flows through the fetal circulation. So if we start with the aorta, the blood is pumped out of the heart, so you've got oxygenated blood coming out of the heart, going to the body, down this way. But a portion of that blood, once it is split into the common iliacs and then the internal iliacs, a portion of the blood comes into the umbilical arteries. And this blood flows through the umbilical arteries into the placenta. And the placenta is where the fetal blood and the maternal blood come very close together, and nutrients from the maternal blood can transfer into the fetal blood, and all the waste products from the fetal blood can transfer into the maternal blood. So once they've been through the placenta and all that good stuff has happened, the blood flows out of the placenta through the umbilical vein. Now the umbilical vein is connected to a shunt. So this is lovely oxygenated blood coming out of the umbilical vein. Now 20 to 30% of that blood goes through a shunt called the ductus venosus, which is here. And 20 to 30% of that blood joins the inferior vena cava directly. So all that lovely oxygenated blood goes straight up the inferior vena cava into the right side of the heart. Now the 70 to 80% of the rest of the blood joins with the portal vein going into the liver, and then once it's been through the liver, it comes out of the hepatic vein and also joins the inferior vena cava. So you've got all that lovely oxygenated blood coming into the inferior vena cava into the right hand side of the heart. Now this is where we meet our second shunt, and this is called the foramen ovale. So what this is difficult to see on this diagram, but what essentially this hole does is it's a hole in the wall, the septum between the two atrium, or the two atria. So it allows blood to flow from the right atria, bypassing the lungs, bypassing the the right ventricle, straight through into the left atrium, where it can go into the left ventricle and out to the rest of the body. Okay, so the foramen ovale allows oxygenated blood to bypass the lungs. Now, not all the blood goes via the foramen ovale. Some of it goes via the right ventricle into the pulmonary artery, or the pulmonary trunk here. Now this is where we come across our third shunt, which is called the ductus arteriosus. Okay, now this is a connection between the pulmonary trunk and the pulmonary arteries and the aorta, which means that once again blood can bypass the lungs and go straight from the right ventricle into the pulmonary trunk, into the aorta, and down to the rest of the body. So here we have two ways, the ductus arteriosus and the foramen ovale, for blood to bypass the lungs in the heart, because we don't need circulation going to the lungs. The lungs aren't really doing much in the fetus. Now these shunts are aided by the fact that in the fetus the pulmonary vascular resistance is very high, and this is because the alveoli are all closed and everything in the lungs is sort of squeezed. So flow is always going to prefer the path of least resistance. So instead of going into the pulmonary arteries, it flows into the aorta. But what happens at birth is the baby takes its first breath, and this causes all the alveoli in the lungs to expand, decreasing the vascular resistance in the pulmonary vessels. There's also a drop in the circulating prostaglandins in a response to the increased oxygenation of the blood from taking that first breath. Prostaglandins are important for telling the ductus arteriosus to stay open. So when you have a drop in these circulating prostaglandins, the ductus arteriosus closes and becomes the ligamentum arteriosum. At this point, the foramen ovale closes and it just becomes a sort of notch in the right atrium and the left atrium called the fossa ovalis, but there's no actual hole there. And this allows normal adult-like circulation to happen after that first breath. Finally, the ductus venosus will close automatically because obviously at birth the umbilical cord is cut, and so there's no circulation coming through this umbilical vein. The only circulation is coming through the portal vein. So everything behind this line, sort of thing, becomes obsolete. So this will just functionally close on its own and then eventually turns into something called the ligamentum venosum that we can still find in adults. So that's fetal circulation. Thanks for tuning into this video. If you found this helpful, then there's plenty more resources to find. The only circulation is coming through the portal.
Okay, so I think you got an idea. Do you have any doubt?
No doubt, miss.
So can we continue with the class? Okay. So that's it with the fetal circulation. So till the birth of till the baby is inside the uterus, it will be having 4 adaptation. Then after it is coming out of the uterus, since the placental cord is cut off or cut off, there will be changes in the baby, and the baby will be adopted to the new thing. So once it is adopted to the new thing, the extra adaptations will just get converted into a ligament or a it will just get converted into a ligament or a tendon. Is that clear? Okay. So next is regarding the physical and physiological changes of pregnancy. So here we will see what are the physiological changes that is going to happen in a body, and because of the physiological changes, what are the complications they might have. And in the next class, we will see how as a PT we will be able to help them. So first is what is the main cause of the pregnancy, main cause in the physiological change. So during pregnancy or immediately after the pregnancy, there are interactions of the 4 hormones. So because of this interaction of the hormones, you will have all the physical and physiological changes happening in the body. So one is the hormones will be the hormones will be influencing the collagens and the smooth muscles, and this collagens and the smooth muscle will undergo changes. Okay, so this is the first thing. So immediately, like as we know, we saw last class, this FSH and LH will be secreted first. Then as soon as the egg is getting ejaculated into the fallopian tube. So in the fallopian tube, the egg will be meeting the sperm, and if there is any pregnancy happen, or if there is any fertilization happen, then that will be mediated to the corpus luteum. So the corpus luteum will be intimating, or it will be secreting the HCG hormone. So once this HCG hormone is secreted, there won't be any FSH and LHS stimulated. So this HCG hormone is the main hormone that will be leading to the growth of the fetus. Okay, so this hormone will be stimulating the prolactin, and this hormone will be stimulating the relaxin to make the body ready for the pregnancy and make the person ready for the delivery. Okay, so for these two things, this hormone is only will only be the responsible factor. Then, so first is like because of the hormonal changes, the body will be getting lot of physical and physiological changes. Second thing is there will be increasing in the blood volume. So as we know, we have the fetal circulation. We also have the mother's own circulation. So the mother have to take up both the aspects. So since she needs to take up the both the aspects, there is need of extra blood volume. So this extra blood volume will lead to changes to the uterus and the kidney. So this is the second factor. The third is because of the displacement of the abdomen or the uterus when the baby is very small till the 2 months time or till 8 weeks, the uterus will be remaining inside the pelvic floor or pelvic organ. Then slowly the pelvic organ, since it is made up of bones, it will be harder part. It will not be getting elongated. So because of that, what will happen? The uterus, it will come out of the pelvic cavity and it will be moving into the abdominal cavity. So when it is moving into the abdominal cavity, the stomach will become bigger and bigger to getting adopt for the uterus. Okay, so this increasing in the in the abdomen, this will change the center of gravity or line of gravity of a particular person. So this will again lead to lot of physical and physiological changes. Okay, then the fourth factor is there will be increase in the body weight of the mother because she needs to take care, she needs to hold both the baby and the mother. So the baby, at least like it will be like there will be slowly increase in the baby's weight, and that weight also will lead to increase in the body weight. Exactly. So these are the four factors which are responsible for the uh, uh, physical and physiological changes in the mother. So first we will see what are the changes that will be happening in the endocrine system. So endocrine system is nothing but the system which holds the glands, isn't it? So this system is responsible for the hormones. So since the hormones are the major issues, so here we will see the endocrine system first. So we will be seeing three main hormones that will be secreted during the pregnancy. One is progesterone, other one is estrogen, other one is relaxin. So the effects of progesterone are, first it reduces the smooth muscle. So smooth muscles means like in the body, I think you know what are the types of muscle. One is smooth muscle, another one is like skeletal muscle, striated, non-striated, like that you have a lot of types. So in that, if you see the first, this progesterone will be affecting the smooth muscles. The tone of the smooth muscle will be reduced. So the tone of the smooth muscles reduced means like abdomen, especially if you see abdomen is the main area where you will have the smooth muscle. So the tone in the abdomen will be reduced. That's why you have that's why when the uterus is pushing out into the abdomen cavity, the abdomen will be getting displaced and it will be keep on increasing in its shape and the size. Okay, so that is mainly because of the effect of progesterone. Then, so the first is like it will reduce the tone of the smooth muscle. So automatically when you see the blood vessels also will be a smooth muscle. So there will be changes in the blood vessels, like the blood vessel will undergo dilatation. The when once the blood vessel is undergoing dilatation, automatically the resistance to the blood flow will be reduced. So blood pressure is nothing but the resistance offered by the blood vessels to the flow of the blood. So when this blood pressure, when this blood vessels are dilated, automatically the pressure exerted on the blood flow will be reduced. So this will lead to reduction in the blood BP or blood pressure. Then there will be dilatation of the other like urethra, like dilatation of the small intestine, large intestine, and all those things. So once there is dilatation of the small intestine and large intestine, it will be undergoing lot of water absorption, and because of this water absorption, automatically there will be like constipation in the person, constipation. So the peristaltic movement will be affected, and this will lead to constipation. Okay. Then if there is like lot of changes in the urethral tone, this will lead to relaxation of the urethra, and there will be more amount of urine or excretory fluid will be collected in the bladder. So they need to empty the bladder more often. Okay, so this is the first effect because of progesterone. Second is there will be increase in the body temperature. So maybe the increase will be from 0.5 to 1. So that much degree changes will be happening in the body. Okay, then third is there will be hyperventilation. Why there is hyperventilation means because the heart has to get accommodated to the newborn as well as to the new demand of the blood flow. So because of the baby, there is more demand on the blood flow. So to accommodate that, the heart will be undergoing changes. So there will be hyperventilation because of the need of oxygen. Okay, then next is there will be development of breast, alveolar, and glandular cells. That is the milk, the breast will get ready to milk production. Okay, so that's why there is increase in the uh, granular cells. Then next is increase in the fat storage. So during the pregnancy, there is a lot of needs of the energy, and the mother needs a lot of energy during the delivery also. So the body will get ready to accumulate lot of energy, that is through fat. So the body will be trying to store a lot of fat so that it can use it at the end of the delivery. So these are the 5 uses of effects of progesterone. Next is estrogen. So estrogen will help you to increase in the growth of uterus and the breast ducts. So the changes in the breast shape and size is because of this estrogen, and there will be increase in the levels of prolactin, which is like which is the main hormone for the milk production. So the breast is getting ready, uh, the breast is getting ready for lactation. So there will be lot of other activity that will be going on, and that is influenced by this prolactin hormone. Then next is like relaxin hormone. So this relaxin hormone is very important to relax the joints, especially in the pelvic joints. So the pelvic joints, the capsules and the collagens, everything have to undergo relaxation, and that is by this relaxin hormone, which is again secreted or stimulated by the estrogen. Then, because of the relaxation of the smooth muscle, the water retention in the body will be increased, and that may lead to calcium retention also. Is that clear? So the smooth muscles will undergo relaxation, and because of that, the water retention will be more, and because of the more of water retention, there will be lot of sodium retention also. Then the last one is the higher level of vaginal glycogen, which will be leading to some kind of different coloration or pink coloration in the vagina and the cervix. So when if a doctor is observing the vagina and the cervix through any equipment, then she will be able to see the discoloration. This is also one of the sign of pregnancy. Next hormone is relaxin. So the main use of this relaxin hormone is to relax the collagen fibers in the target tissue. So which is the target tissue? The pelvic floor, the joints that is around in and around the pelvic floor, and the cervix are the main target tissue. So these target tissues are getting affected by this relaxin hormone. Is that clear? So this will be taking place throughout for nearly 9 months. So the body will be getting ready for delivery. Okay, so during delivery, the pelvis will undergo a lot of relaxation and there will be space for the baby to come out. The next is inhibition of myometrial activity during pregnancy up to 28 weeks. So up to 28 weeks, there should not be any uh, muscle activity in the uterus. That is the myometrial layer of the uterus. So if there is any activity in the uterus, then the muscle will undergo contraction and the baby will be aborted outside. So to inhibit this effect, this relaxin hormone is very, very important. So till 28 weeks, the relaxin hormone will be controlling inhibiting this particular activity so that they won't get any miscarriage or they won't get any abortion. So next is like the uterus have to ascend upwards and it has to be uh, undergoing distension to accommodate the baby, and that work is mainly done by this relaxin hormone. Then towards the end of the pregnancy, the relaxin hormone will be increasing so much, so there will be more of softening of the collagen content. Okay, so this may also have a role in the mammillary activity. So then this will be relaxing the pelvic floor muscles, so that will be leading to a lot of incontinence and a lot of other problems. Is that clear? So these are the effects of relaxing hormone. So we see the physical and physiological changes according to the system wise. The first system is endocrine system. So any doubt on this endocrine system?
No, miss.
So next is reproductive system. So in reproductive system, so normally after the puberty of a girl, there will be a continuous cycle will be happening. So that is called the menstrual cycle, and that is called as the menstrual flow. So this continuous cycle will be affected first. So that means the cycle will be stopped. So that there won't be any sign of bleeding. So that is the first sign of pregnancy. Okay. So for example, instead the female have to have the menstrual flow on every 28 day, but because of the pregnancy, the first thing is there won't be any flow or there won't be any blood oozing. So this is called as amenorrhea, and this is the first sign of any pregnancy. Okay, then next is there will be increasing in the vasculature or blood supply to the cervix and the vulva. So the cervix and the vulva will be richly supplied by the blood, and this rich circulation will lead to pinkish color or will lead to uh, dark red color, especially in the cervix and the vulva, and that is called as Chadwick sign. So this is again another sign of pregnancy. Okay, Chadwick sign is another sign of pregnancy. Next is leukorrhea. So this is increase in the vaginal discharge. So the vagina normally will be having low pH, and because of that there will be more chance of infection. So to reduce that, the alkalinity will be increased. There will be more discharge in the vagina, and it will be richly supplied by glucose. So this will lead to low reduce the pH level in the vagina. Okay, so this reduction in the pH level of the vagina will be leading to more chance of getting infection. So that's why the pregnant mothers are more vulnerable for getting any urinary tract infection. The next is in the ovary. So in the ovary, there is slightly enlarged because the corpus luteum, instead of undergoing discharge, it will be just roaming inside the ovary. Okay, so it will be just roaming inside the ovary without any degeneration, because the corpus luteum has to secrete the hormone, progesterone and estrogen and the HCG till 3 months. So till 3 months, the uh, ovaries will be little bit enlarged because of the corpus luteum. Okay. The next is in the uterus. So normally uterus will be around 50 grams, but because of the increase in the baby, the uterus will be increased from 50 to 1100 thousand millions will be, sorry, 11 1 kg 100 grams of weight will be there. So normally the uterus will be around 50 grams only, but because of the baby and other things, slowly it will increase in the weight and it will be increasing in the size also. So here if you see the fundal height, which will be present inside the pelvic cavity till the second month. So till the second month, the uterus will be inside the pelvic cavity. Then at the third month, it will be seeing out. Fourth will be more. Like that, if you see, the fundus of the baby will be increasing till here at the 8th month. After the 8th month, slowly it will reduce down. Okay, so after the 8th month, it will reduce down. Till the 8th month, it will be keep on increasing in the fundal height. And because of this itself you can um, because of this only you can the fundal height will be normally seen outside, and by seeing this itself you can decide whether the mother has any growth retardation or not. Okay, so if it is according to the normal height, then there is no intrauterine growth retardation, or there is no growth retardation in the uterus. Okay, next is regarding the cardiac output. So there will be increase in the cardiac output, as I said. Uh, as I said, like there will be increase in the cardiac output because there will be increase in the blood flow. And this increase in the cardiac output will be, I'll explain that little later in the cardiac system. Okay. So next is in the back, it is called as Baxton and Hicks, or you can say false delivery pain. So this is like a irregular or asymmetric contraction of the uterus. So uterus will be undergoing continuous change, and because of that, there will be a little bit movement or a little bit uterine contraction that will be happening in the uterus. Okay, so that is called as Baxton and Hicks. And this is a false labor pain, and this will be lasting for less than 30 seconds. So normally it will be irregular. And this can happen after 5 months itself. You will be like they will be able to feel this Baxton and Hicks. So next is cardiovascular system. I think like before going into the next system, I will give you some 5 minutes break. Can we start?
Yes, Miss.
So next is regarding the cardiovascular system. So the first is, as the abdomen is descending upwards, the heart will be pushed upwards. Okay, so when the uterus is passing from the pelvis, it will be going into the abdomen, and the abdomen will get distended. So because of that, the diaphragm will be pushed upwards. So when the diaphragm is pushed upwards, automatically the heart also will be repositioned. Okay, so this is the first change. Second is the size of the heart will become little bigger. Why? Because it has to pump more and more amount of blood. So as it is, as the compression and distraction of compression and relaxation of the heart will become harder and harder. Since it is moving more like more number of times, the heart will undergo dilatation as well as it will undergo hypertrophy. Okay, then next is regarding the lung and heart volumes. So here, if you see, the stroke volume will increase. First thing is the cardiac output will increase. So what is cardiac output? Stroke volume into heart rate is your cardiac output, isn't it? Cardiac output is equal to stroke volume into heart rate. So stroke volume into heart rate, first the cardiac output will be, the increase in the cardiac output will be maintained by increase in the heart rate. This will be happening in all the human being. So if you just suddenly run, what will happen? There will be increase in your heart rate, isn't it? So that is because the need in the sudden increase in the blood flow will be accommodated or will be compensated by increase in the heart rate. I think it got disconnected, right? So I'll start again. So because of increase in the need of blood, the cardiac output will increase. So this cardiac output, increase in the cardiac output will be given by increase in the heart rate. So, but when you want to have this for a very long time, only merely by increasing in the heart rate will not be able to give the needed cardiac output. So, automatically the stroke volume also will be increased. I hope all of you knows what is stroke volume and cardiac output. Cardiac output is the amount of blood that is coming out of the heart after each pump. Stroke volume is stroke volume is the amount of blood that is coming out of the heart in each minute. Okay, so this increase in the cardiac output will be maintained by increase in the heart rate as well as increase in the stroke volume. So initially there will be more amount of increase in the heart rate compared to stroke volume, but later as the time goes on, the stroke volume will take up compared to heart rate. Okay, then there is increase in the oxygen consumption because there is need of oxygen will be higher. So there will be increase in the oxygen consumption. So the mother's respiratory rate will be little higher compared to normal women's respiratory rate. Then there will be definitely a decrease in the blood pressure. Why? Because there is influence of the smooth muscles. Because of the smooth muscle undergoing relaxation, the blood vessels also will undergo relaxation. So the heart, the BP is nothing but the pressure exerted by the blood vessels on the blood flow. So since the blood vessels are elongated, the pressure exerted will become less. So that's why there will be decrease in the blood pressure. Okay, then there will be definitely increase in the blood volume, and to accommodate that there will be increase in the plasma volume. So if you see the inside the blood components, everything will increase little bit. So at least 10 to 20% of all the blood components, that is plasma, white blood cells, red blood cells, everything will be increasing. So this is why there is increase in the blood volume. Next is regarding the breast. So normally the breast will be like a muscle mass, but during pregnancy only there will be a lot of changes that will be taking place in the breast. So because that is especially because of the because of the prolactin. So there will be encroachment or venous prominence in the breast. So when there will be more blood flow to the breast. Because of that, the mother will be feeling like a tinkling sensation in the breast. And sometimes some people will have breast tenderness, but most of them will not have this kind of breast tenderness. And this tinkling sensation is because of the blood flow to the glandular tissues and the other tissues which is present in the breast. And there will be a tubercle called Mactomeres tubercle that is present in the nipple area. So this tubercle will undergo elongation, and this tubercle will sometimes secrete a particular fluid, and that is called as sebaceous. It will be secreting a particular fluid, and this fluid will give the extra lubricants or extra moisturizing for the nipple. So this will make the nipple softer so that the baby will be able to drink the milk properly. Then immediately after delivery, the first secretion is called as colostrum, and this will be having lot of nutrition value. Okay, so that is immediately after the delivery, they will be having a secretion that is called as colostrum. So next is gastrointestinal system. So here if you see, the complete gastrointestinal system is made up of smooth muscles, and because of that all the smooth muscles will undergo relaxation. The complete GI tract will undergo relaxation, and once the GI tract is undergone relaxation, the esophagus also will undergo relaxation. But there will be a valve that will be closing the esophagus and the abdomen. So sorry, in between the esophagus and the abdomen, there will be a valve which normally closes. So whenever the abdomen starts to grind the food particle, the valve will be closing so that the acid or any food particle will not return back through the esophagus. But because of the smooth muscle changes, the esophagus will undergo relaxation, but the valve will be remaining in the same size. So because of that, the valve will not be able to close the esophagus properly. So the food particles might regurgitate little bit above, which will lead to heartburns. Why heartburns? Because the abdomen will have lot of acidity, and when this acid escapes through the esophagus, it will cause the burning sensation. Okay, so that's why the pregnant mother should not lie down completely fat. They have to lie down a little bit inclinated so that they don't have this regurgitation. So this is one thing. Another thing is the mothers will be having morning sickness, that is called as like vomiting kind of sensation, nausea and vomiting kind of sensation. This is because of the presence of HCG. So this HCG hormone will lead to this kind of sensation, like a vomiting sensation or something like nauseated kind of a feeling. So whenever she eats something, she will immediately will try to vomit, and that is because of the HCG hormone. And this HCG hormone will be present in the first 3 months. After that, slowly the HCG hormone will reduce. So that's why in the first trimester, the mother will be having lot of the mother will be having lot of morning sickness. Then slowly in the second and third trimester, they will not have any morning sickness. Then sometimes the mother will be having a different kind of carving. So different kind of carving towards non-food items like a chalk, clay, they want to eat mud, like that. So they will be having a different carving sensation. So that is called as dietary carving. And since the all the smooth muscles are undergo relaxation, the abdomen is also undergoing relaxation, which will be leading to constipation, because the food particles will be there in the abdomen for very long time, and because of that there will be lot of water absorption taking place. So that's why you feel like like constipation. Then uh, then if you see, the bile cannot flow from the liver to the duodenal. This is because the abdomen is compressed and there won't be proper flow between the uh, proper flow of the bile from the liver to the duodenum, and this may compress the liver, and sometimes it will lead to some other problem. Okay, the next is hyperemia. Hyperemia is increase in the blood flow to different tissues. So here, whenever you eat, the mother will feel more of tired because of this increase in the blood flow to different body tissues. So the mother will like to take rest in between. Otherwise, they will not be able to maintain the blood flow to all the parts. They may also have softening of the gums. So because of that, they may have some tooth fall, or if they already have some tooth problem, decay or any other thing, that also will lead to softening of the, that also will lead to falling of the teeth. Then hemorrhoids. This hemorrhoids is because of compression of the compression in the of the blood vessels in the anal region. So this is because of the constipation when the patient is compressing, or when the patient is strictly straining more for defecation. The defecating material will compress the blood vessels, which will lead to swelling, and this swelling is called as hemorrhoids. When this hemorrhoids break, then they will be having some leakage, or there will be some blood tearing of the blood vessels in the anal region, and they may be having some bleeding. Then next is the appendix may be displaced in the side because of the distending of the abdomen area. Okay, in the skin, if you see, there will be lot of blood flow to the skin, and this may lead to some shining or blushing in the mother, especially in the first trimester. They will be having some shine or a blushing. So this is because of increased blood circulation to all the parts of the body. Then other than that, there will be something called stria gravidum. This stria gravidum is a stretch marks present in the abdomen. Okay, so after delivery, if you see, there will be more amount of this stria gravidum. Okay, then next is hyperpigmentation. So this hyperpigmentation is because of the hormone estrogen and melanocyte. So that will be stimulating the hormone, and that will lead to blushing in the mother. Next is called as linea alba and linea nigra. So this is because the yesterday we saw about, last class we have seen about the rectus abdominis muscle. So the rectus abdominal muscle is a sheath that will be running from the ziphisternum to the lower part. So it will be having a separation in the middle, and because of the distension of the abdomen, this separation will elongate, and that is called as linea alba, and this separation is seen from the skin from outside as a black in color. So after slowly, if you see, the linea alba will become as linea nigra as the marking will become darker and darker, and it will become like a black line. So that black line is called as linea nigra. Then next is chloasma. Chloasma is the dark patchy areas in the cheek, nose, lips, upper lip, forehead, like that. You may have some patchy kind of things in the face. So that is called as chloasma. Next is weight gain. So definitely there will be increase in the weight gain because of the fetus. So not only the fetus, the fetus will also there will be a lot of fluid inside the uterus. So that also will lead to increase in the weight of the person. So normally there will be increase in the breast size. There will be increase in the abdomen. All this will lead to weight gain. So if you see here, normally around 10 to 12 kg weight increase will be present in the mother. And this will not be regularly, this will not be immediately, but this will increase gradually. So per month, 1 kg of weight will be increased. So this is the weight distribution. So there will be more blood volume that will increase to around 1 kg, increase in the breast size that will lead to half kg, then fetus, placenta, amniotic fluid, and increase in the uterus. All this will lead to remaining weight. Then there will be fat deposit that will be in the thigh region. So the lot of fats will be deposited uh, for the energy that is needed in the late times of pregnancy. Then there will be extracellular fluids that will be present in the legs. So all these will lead to around 10 to 12 kgs of weight gain. The next is nervous system. So nervous system is because of hormones, there will be a lot of hormonal mediated changes, and this will lead to uh, some compression in the nerves, and that will lead to changes or changes in the nervous system. So here, if you see, the mothers will be having a lot of mood swings. Sometimes they will be very laughing, sometimes they will be crying. So the extreme mood swings will be there. They will have a lot of anxiety, lack of sleep, nightmares. All these things will be there, and all these things are because of the hormonally mediated changes in the nervous system. And they will also have water retention, which will lead to nerve compression, and that will lead to tinglingness or paresthesia. Okay. Next is in the urinary system. So in the first trimester, there will be presence of HCG in the in the urinary system, which will act as the confirmatory test of the pregnancy. Okay. Then slowly after 3 months, this HCG hormone will reduce. Then there will be increase in the maturation. Why? Because that too, especially in the first 2 months, this is because there will be compression in the uterus will be present in the pelvic cavity in the first 2 months, and the uterus will be compressing the urinary bladder. So the urinary bladder will not be able to accumulate more amount of fluid, and this will lead to compressing of the this will lead to maturation many times. Okay, so that's why there will be increase in the maturation. Then there will be more blood supply to the urinary tract, which will also lead to increase in the waste disposal. That means more amount of urine will be produced. So increase in the size and the weight of the kidney, and the urethra will be hypertonia. So this will lead to dilatation, and this also will lead to lot of urine collection and lot of urine maturation happening. Next is in the musculoskeletal system. So musculoskeletal system, there are a lot of changes because of the four factors. One is there is increase in the joint laxity. This is because of because of relaxin hormone. So because of relaxin hormone, the joints will undergo laxity, and there will be a lot of movement. So normally in the pelvis, there won't be any movement at all. But during pregnancy, because of the relaxin hormone, there will be movement in the pelvic region. Okay, then because of the increase in the abdomen distension, there is changes in the center of gravity, and this will lead to change in the other aspect. Okay, so when there is changes in the center of gravity, automatically the line of gravity also will move, and this will lead to a lot of physical changes that is happening in the body. Then next is postural changes. Postural changes is because of the increase in the abdomen, increase in the weight. All these will lead to postural abnormality, and the changes in the center of gravity and line of gravity also will lead to change in the posture. Okay, then there is increase in the edema in the hands and feet. This is because of increase in the extracellular fluid that is present in the body. So these are the physiological changes that is taking place in the body. So because of the changes, because of this changes, there will be some complications or there will be some discomforts. So we will be able to work on the discomforts. We will be able to play a major role in during on the discomforts, and we will help them to overcome the discomforts. But complications, we may not have much role in complication. Okay, so do you want any break, or we will continue with the complications? Do you want any break or we will continue? Okay, just few minutes rest. Rest. My throat is little bit irritated. Okay. Okay, we will start. So, because of this because of this physical and physiological changes, there will be little bit complication. But sometimes, like we need to see, we need to weigh which is like if the complication is more severe, then sometimes they need to abort the baby, or sometimes they need to abort the baby. So depends on the weightage, the doctors will decide whether to abort the baby or go with the particular delivery or go with the particular pregnancy. So the first complication is anemia. So anemia is reduced iron deficiency. So this will lead to, actually if you see in the blood, the hemoglobin is the main thing that will be carrying the oxygen to the needed parts. So if the hemoglobin is reduced, then the transportation of oxygen will be reduced. And this hemoglobin is nothing but the iron. So if there is iron deficiency, automatically the hemoglobin level will fall. And most of the time, this pregnancy will lead to reduction in the iron deficiency, because the baby will be absorbing a lot of ions from the mother's body. And this will lead to reduction in the iron in the mother's body. And that is called as anemia. So if any like normal hemoglobin level should be around 11 to 13 in a women. For men, it will be more than 16, like around 16. For women, it will be 11 to 13. So something lesser than that is called as anemia. And if they call, like if it is lesser than 6.5, they call it as very severe anemia. And very severe anemia will lead to very serious complications. That is even the death of the mother. Like it will lead to death of the mother. So they need to check every time when the mother is going for a checkup. They will be doing this anemia test. And not only that, you can also check the anemia in your fingertips and the eyes. So if you compress the fingertips and leave it, if the redness is coming immediately, then they are normal. But if it is very pale, then they are anemic. Next is antepartum hemorrhage. So antepartum hemorrhage is the bleeding from the genital tract at any stage from 34 weeks. So this antepartum hemorrhage is due to placenta previa. So I will show you what is placenta previa first, so that you will get an idea. So here if you see, this is the placenta. So the placenta has to get embedded in the uterus, and normally the placenta have to be get embedded in the near the fundus. So if the placenta is getting embedded here, then the baby will have a lot of space to move around. Okay, and the baby will be, it is easy for the baby to get delivered. But if the placenta is getting attached at the lower part, then there is more then it is called as placenta previa. And because of this placenta previa, whenever there is a small muscle contraction, small uterine contraction, then the placenta will get teared, and there will be bleeding. And this bleeding will be getting stored in the uterus itself for a long time, because the cervix will be getting closed completely. The cervix will be sealed, so the blood cannot ooze out through vagina. So it will be remaining there. When the blood is getting collected more, then suddenly it will be rushing out of the vagina. So that is called as antepartum hemorrhage. So most of the time, this antepartum hemorrhage will lead to abortion of the baby or miscarriage of the baby. Okay, so that's why it is called a serious complication. So next is associated pathology in the breast. Sometimes if the mother is getting delivered later than the like later than 30 years, then there is more chance of breast cancer or some kind of lesions like this. So this is there will be increase in the blood supply to the breast, and because of that, the wounds will get bigger and the wounds will get ruptured, and this will lead to this kind of problem. So this is all associated pathology. Okay. So next is breech presentation. So breech presentation is normally the baby will be getting embedded uh, in the upper part. Then through the placental cord, this is the placental cord. The baby will be keep on moving. But after 32 weeks, the baby will come and get fixed in certain position. That is, the baby will be getting ready for delivery. So after 32 weeks, still if the baby's head is not coming and getting fixed in the cervix, then it is called as breech position. Okay, so normally the baby's head has to come down and get fixed here after the 32 weeks. But if it is not getting fixed, then it is called as breech position. Normal presentation is the vertex being presented first. Okay. So this the reason for the breech presentation can be oligohydromias. Oligohydromias means reduction in the amniotic fluid. Then placenta previa. So we know what is placenta previa. So the placenta, if it is getting embedded at the lower part, it is called as placenta previa. Then if the mother has any fibroids are bulk muscle mass which is present in the uterus. Then if the pelvis is very concentrated, contracted, then also the baby will be fixed in a abnormal position. Some fetal anomalies also will lead to this kind of problem. Then polyhydromias is increase in the amniotic fluid. Then multiple pregnancy also will lead to this kind of breech presentation. Okay, so every month when the mother is going for a checkup, they will be doing the scanning and they will find out the position of the baby. Okay, so if it is not fixed properly, sometimes they will be doing it manually or sometimes they will go for a cesarean section. Next is cardiac disease. See, pregnancy will not lead to cardiac disease, but already if the mother is having some cardiac problem and because of pregnancy, it may lead to increase in the problem. Or already the mother is having some cardiac problem, this pregnancy will lead to increase in the demand of cardiac system. So this will lead to some problem. So that is the issue. Otherwise, directly pregnancy will not have any problem with the heart. Then diabetes mellitus. This diabetes mellitus is very deadliest complication. The pregnant mother with diabetes mellitus need to be carefully supervised. So no, if the mother is diabetes already before pregnancy, they will be giving insulin and they will be maintaining the diabetes level in the normal level. If it is not under control, then sometimes they will be admitting them in the hospital and then they will be giving the injection. Okay, then this increase in the diabetes will lead to increase in the baby size. The baby will become very bigger and it will reduce the chance of getting normal pregnancy and they have to go for a cesarean section pregnancy. Okay, then it also leads to polyhydromias. Okay, you need to keep that in mind. And if the sometimes the mother may be normal, but because of the pregnancy, they may have this gestational diabetes. So they may have diabetes, and that is called as gestational diabetes. So only during pregnancy they will have this diabetes. Okay, that is called as gestational diabetes. Next is ectopic pregnancy. Normally, the egg will be getting will be moving in the fallopian tube, and it will be going in the fallopian tube. At the ampulla, it will be undergoing fertilization, and the egg will be moving towards the uterus, and it will be getting embodied in the uterus. But sometimes what will happen? Instead of the egg getting embodied in the uterus, it will be getting fixed in the fallopian tube itself. So in the fallopian tube itself, it will get fixed. So this will lead to rupture of the fallopian tube because there is no chance of expansion of the fallopian tube. So like up the uterus, the fallopian tube will not expand. So after certain size, the fallopian tube will not be able to expand. So it will get ruptured. Okay, so it will sometimes it will lead to death of the mother also. So you need to be very careful. So that's why when after immediately getting to know that the mother is pregnant, at the 6th week or 7th week, they will undergo a scanning. And in that scanning, they will confirm whether the mother is in, whether the is inside the uterus or in the fallopian tube. Okay, that is very important. Next is fibroid. So this is very common problem in almost all the South African women. So this is fibroid as increase in the muscles, that is especially the second and the third layer of the muscles. Only the endometrium will undergo growth and it will undergo shedding. But here there will be growth of the myometrium and the perimetrium. So that is called as fibroid formation. and that fibroid formation, that fibroid may compress the space in the uterus. Okay, so it doesn't have direct problem, but indirectly it may get compressed with the baby. Okay, and it will cause severe pain. Next is intrauterine growth, death. So in the uterus, the baby have to undergo gradual growth. But if the growth is stopped at some time, and the baby may die inside. So that is called as intrauterine growth. So normally, whenever the mother is going for the checkup, every time the doctor will be checking the fetal heart rate and the fetal heart rate and the movement. So if the movement is very less, then definitely it might lead to intrauterine death. And if there is any placental insufficiency or eclampsia also, there is chances of death of the baby. Okay. Sometimes, even if it is not dying, there may be intrauterine growth retardation. And this intrauterine growth retardation is because of lack of placental function. So, the placenta, if it is not able to supply the needed oxygen, it may lead to growth retardation, and slowly it may lead to death of the baby. Okay. So, the baby have to have a proper blood supply. If there is any lack in the blood supply, then it will lead to death and reduction in the growth of the baby. And the other reasons of this intrauterine growth retardation is hypertension of the mother, then small placental separation or infarction, failure of placenta to develop. All these will lead to reduction or no blood supply. That will lead to intrauterine growth retardation and sometimes death of the baby. Next is oligohydromias. Oligohydromias means deficiency in the amniotic fluid. So the uterus need to have the particular level of amniotic fluid. So the baby will be moving in the uterus freely and it will be swimming in the uterus freely. But when this fluid is reduced, then the baby's movement will be restricted. That is one thing. Another thing is it also indicates certain abnormality in the baby. So normally what will happen, the baby will be drinking the amniotic fluid, then slowly it will be excreted through the urine. But when the baby's kidneys are not functioning well, then whatever fluid the baby is drinking will not come out through the urine. This will lead to reduced amniotic fluid. Okay, so you need to be very careful. They will be checking normally all the fluid levels, everything will be checked by the doctor through the ultrasound. So the doctor will advise the mother to take in lot of liquids, especially tender coconut, so that the amniotic fluid will be increased. And this will lead to some abnormalities also, like talipus torticollis and other thing, because of lack of space the movement will be restricted, and this will lead to some deformities of the in the baby. Okay. The next is placenta previa. So normally the placenta have to be getting embedded high in the uterine wall. But if it is lying closer or in other places, then it is called as placenta previa. So there are four types of placenta previa. That is, if you see in the first stage, this is the placenta is on one side of the uterus, but near to the cervix. So normal delivery is possible in this particular thing. In the other second stage, if you see, the placenta is very closer to the cervix. So during normal delivery, there is more chance of getting abruption of the placenta. And instead of baby coming out, the placenta will be coming out, which is again a complication, and it may lead to death of the baby. Okay, so the baby has to come out first. In the third stage, if you see, the placenta is completely covering the cervix, and in the fourth stage completely it is over the cervix. So in this type there is chances of normal delivery. In this type there is the normal delivery is possible, but it has some complication. In this two types, there is no chance of normal delivery at all, and they should not try for normal delivery also. If they try, the placenta will come out first and the baby will die inside. Next is pregnancy-induced hypertension, or it is called as preeclampsia. So sometimes, as you see, initially the blood pressure will reduce because of reduction of the smooth muscles. The blood pressure will reduce, but suddenly because of some complications or some stress, the blood pressure will increase, and that is called as hypertension or pregnancy-induced hypertension. So this is called as preeclampsia. Eclampsia means fix to the mother during pregnancy. But preeclampsia means it is the first stage of the eclampsia. So you need to be very careful. You need to immediately admit the patient in the hospital, and they have to treat the hypertension. Otherwise, sometimes they may lead to seizures disorder. Sometimes they may lead to stroke, and they may end up in some neurological problems also. So you need to be very careful with the people who are having pregnancy induced hypertension. So preeclampsia is this more occurs more commonly in the third trimester. So eclampsia is again a complication. It is a high due to high blood pressure. There won't be proper blood supply to the uterus, and this will lead to a convulsion during pregnancy, and during labor also it will lead to convulsion, and sometimes they result in death of the mother, or sometimes they result in a stroke and other problems to the mother. Okay, so as a physio, why we are reading all these complications means, if any of the mother is having this complication, then we should not give any exercises to them. So that's why we are reading about this complication, because this complications might end up in either death of the baby or death of the mother. So that's why, like, we read about this complication and its causes, so that when we are giving exercises, we look for these complications, and we should not give any exercises for this particular mother. Is that clear? So far we have seen the physical and physiological changes, and like so far we have seen what is pregnancy, how it happens, how the hormones are controlling the pregnancy, and because of the hormonal control, what are the physical changes that is happening in the mother and how it is affecting them. Okay, so next class we will see what are the discomforts they will be having because of pregnancy, and as a PT, how we will be able to help them. Is that clear? Okay, now, any doubts?
No, Thomas.
Okay, in the first two topics, there are not much of practicals. Okay, practical hours are not there, but still, like, I have few of the videos to tell you what is about, tell you about the uh, um pelvis, pelvic inlet, outlet, what is the importance of pelvic inlet and outlet. Okay, but there is no practical sessions for this particular topics. So I will upload an LMS, and you can have a look, and if you have any doubts, then we can have a discussion. Is that clear? So next week we will read about the antenatal time, antenatal period. So from next week onwards, there will be practical session. So we will see how we are able to do the practical session along with the theory. So if there is no doubt, then we can end the session. Class rep, can you just send me the name list, because as a few of them are joining the class together in single ID, it will be difficult for me to take up the names. Okay. Okay. So before next class, I will try to is it okay if we have a quiz session? You need to tell me. The quiz will be on this anatomy and physiology of reproductive system. Okay, no problem. You can discuss among yourself and let me know whether to have this quiz or not. Okay. So thank you all. We'll see you next Monday.